10 benefits of artificial intelligence in healthcare. A lot of people are interested in how AI is changing the healthcare business. What if AI could not only make care for patients better, but also change the way we diagnose, treat, and work efficiently? This video will show you the top 10 ways that AI is improving healthcare and how these changes are really changing the way we do medicine. Are you ready to learn more about how AI is changing healthcare? Number 10. The application of artificial intelligence to enhance the outcomes of patients. One of the most important advantages of artificial intelligence in the medical field is its ability to lead to better outcomes for patients. There is a significant benefit to artificial intelligence in healthcare from the point of view of the patient, whether it is related with reducing the length of stay for patients who have suffered from cerebral hemorrhage and pulmonary embolism, or, as the infographic that follows illustrates, reducing the amount of time it takes to admit patients. At the following infographic, a hypothetical patient workflow at a hospital that uses artificial intelligence is compared to one that does not use AI. Number 9. Enhance the coordination of the care team. The capacity of artificial intelligence in healthcare to profit on workflows that are built on teams through clinical workflow optimization is an additional advantage. As an illustration, consider the Pulmonary Embolism Response Team, PERT, that is located at Yale New Haven Health. Through the utilization of IDOC, a retrospective study discovered that the capacity of artificial intelligence to store all relevant information in a single location facilitated the management of communication among members of the PERT, including the transmission of clinical information and photos. Everything came to a head with Number 8. Decrease the amount of employee burnout. AI in healthcare is helping to prevent worker burnout, which is a significant pain factor that is being addressed by AI in healthcare. Every month, staff burnout is recognized as one of the top problems in the health system. This is due to the fact that patient volumes are increasing while workforces are decreasing. One application of artificial intelligence in the healthcare industry is resource allocation, which empowers clinicians to use AI to combat burnout. This is in keeping with the ethos of doing more with less. That is to say, artificial intelligence is capable of appropriately triaging resources in order to address urgent situations at each and every patient touchpoint. Artificial intelligence is being utilized in the healthcare industry to assist health systems in supporting the much sought-after quadruple goal framework. Meet the quadruple aim of the healthcare industry. The ability of artificial intelligence to maximize the functioning of the health system in accordance with the triple purpose is of the utmost importance. Number 7. Providing a better experience for the patient. Improving the health of the population, lowering expenditures, and making the working conditions of care teams more favorable. Through a variety of means, such as the personalization of patient care and the automation of follow-up management, the transformation of data synonymous into information that can be acted upon, the enhancement of workflows and patient triaging in order to reduce costs and increase efficiency, and many other methods, the appropriate application of artificial intelligence in healthcare helps health systems achieve these goals. Exactly what is the significance of accomplishing the quadruple objective? The achievement of the quadruple purpose of healthcare is of utmost importance for health systems, as it offers a comprehensive framework for enhancing performance and, more significantly, the results for patients. Because of this holistic approach, patients are guaranteed to receive treatments that are more effective and efficient, which ultimately results in improved health outcomes and higher levels of patient satisfaction. Additionally, the triple aim targets the sustainability of healthcare systems as well as their efficiency. It is possible for health systems to more effectively distribute resources if they reduce costs by streamlining operations and putting more of an emphasis on preventive treatment. On top of that, enhancing the working conditions of healthcare workers can lessen the likelihood of burnout and turnover, which ultimately results in a workforce that is more stable and motivated. Number 6. Increase patient retention to improve. It is possible that there is no direct cause and effect relationship between greater disease awareness, which includes incidental findings, and increased hospital revenue. However, if there are fewer missed patients in the emergency department and outpatient facilities, then there will be more patient admissions that have the potential to be paid for by the DRG. Our artificial intelligence solutions have, at IDA partner facilities, contributed to an increase in admissions, the activation of clinically relevant advanced therapies, and the retention of patients with long-term surveillance and risk of interventions across a variety of illnesses, including the following. The number of cases of intracranial hemorrhage at the Unfall Krankenhaus Berlin, UKB, rises by 12%, increase of 16% in the number of pulmonary embolisms at Envision Healthcare, a 5% rise in the number of C-spine fractures at Leahy Medical Center. Number 5. Transform the data into information that may be used. With the resources that are available, clinical AI helps hospitals to perform more efficiently rather than more laboriously. Using artificial intelligence in healthcare, care teams are able to improve the decisions they make regarding treatment by combining data from a variety of sources and transforming this vast amount of information into insights that can be put into action. Number 4. Reducing the amount of time patients spend in hospitals. The application of artificial intelligence in the medical field is today of the utmost significance. Those healthcare systems that continue to rely only on human judgment are falling further and further behind in their progress. There was a 19% increase in the length of stay for patients as a direct result of delayed discharges, as reported by the American Hospital Association, AHA. This was the situation in spite of the fact that the number of patients in the operating room and emergency department had dropped. On the other hand, a study conducted by Cedars-Sinai discovered that the length of stay for patients suffering from cerebral hemorrhage and pulmonary embolism was reduced by 11.9% and 26.3%, respectively, when the organization installed an artificial intelligence triaging software. In addition to the fact that it frees up room for new patients, reducing the duration of stay is essential for a number of reasons. One of these reasons is that it reduces the possibility that patients would experience secondary health difficulties as a result of a longer hospital stay. Number 3. Make patient care more individualized. AI's capacity to support tailored patient care is a significant advantage that it brings to the field of patient care. In order for artificial intelligence to enable facilities to better personalize treatment routes, it is necessary to implement an AI platform that is based on images and reports. The utilization of natural language processing, NLP, in conjunction with image-based artificial intelligence algorithms allows for the expeditious routing of patients to the appropriate care teams for swift decision-making through the utilization of mobile and desktop applications. Number 2. A center of profit for healthcare organizations. A common misunderstanding regarding clinical artificial intelligence is that its financial benefits cannot be proved because there is no payer to fund them. This is one of the most popular misconceptions with regard to AI. When it comes to its strategy, this worldview is very basic. Furthermore, hospitals get reimbursed for services that rely on these technologies despite the fact that many business-critical technologies do not have a direct reimbursement mechanism. This is despite the fact that there is currently no direct compensation for artificial intelligence-assisted care. Return on investment, ROI, is the metric that best describes the value of artificial intelligence. As a result of increased capabilities for illness awareness, improved care coordination, and patient management tools, clinicians and health systems that are assisted by artificial intelligence have the ability to discover new revenue streams through clinically acceptable actions. These actions include incidental findings and patient retention. Number 1. Making the most of value. Every single patient touchpoint presents an opportunity for health systems to make the most of all of their resources. The acquisition of new patients is no longer as critical as the retention of existing patients. In fact, it is even more important than the former. Enhancing sickness awareness and resource efficiencies that promote patient retention and optimize patient care chances can be accomplished through the utilization of a linked system of intelligence, which can provide health systems with the potential to benefit from treatment plans that are both predictive and personalized. It makes no difference whether the health system is based on a value-based or fee-for-service funding model. This is always the case. If you're excited to learn more about how AI is revolutionizing healthcare, be sure to subscribe and hit the notification bell. Stay tuned for more in-depth insights and updates on the latest advancements in medical technology.